And welcome to the weekly dementia blog hosted by SpectrumEd. My name is Dr. David Hutchings. I've had a lot of requests come in for us to move into and talk more about the many different forms of dementia. Again, we see that there are many different conditions that can cause dementia, and then there are also this subset of dementias that are progressive in nature. And we have talked about Alzheimer's disease already, and we've also talked about vascular dementia. As a reminder, when vascular dementia and Alzheimer's mix and come together, this is when we have what we call mixed dementia. So we're going to talk about that as well. So one of the ones we're going to talk about next is we're going to be talking about Parkinson's related dementias. These are dementias that we see very often. There are two forms of Parkinson's related dementias. There are what we call a PDD, which is what I'm going to talk about today, a Parkinson's with dementia, or a Lewy body dementia. And that is the type of dementia that Robin Williams had. So how we look at these, and this may help you, the healthcare practitioner, whether you're a nurse, doctor, or therapist, or whoever that you might be working with these individuals, on the clinical symptoms, number one, but also which one are you dealing with. So this is how we begin to look at differential diagnosis between the two. If a patient has motor issues first, so they have Parkinsonian symptoms first, and then develop more cognitive and more of the dementia pieces after, then that's a Parkinson's dementia, a PDD. If it's reversed and we have the memory issues first, or cognitive issues, and then we have the Parkinsonian symptoms after, that is what we would call a Lewy body dementia. For Parkinson's disease dementias, or PDD, Parkinson's disease in itself, what it does is it targets the areas of the brain, the regions of the brain that control your movement. And so we might see tremors, rigidity or stiffness, gait abnormalities, a shuffling gait pattern, and also postural abnormalities. The patient's actually somewhat slumped over. And as this begins to progress throughout the brain, we see that there's increased attention issues, sleep issues, memory, and other cognitive problems. Parkinson's disease is fairly common. We do see Parkinson's, fairly often, and we would say that I think the percentage is about 2% of those who are over age of 65 have a chance of developing Parkinson's disease. So it is fairly common neurological condition. Of the Parkinson's patients, we see 50 to 80% of those patients develop some form of dementia, whether that's a PDD or a Lewy body. So some of the clinical symptoms that we'll see with a Parkinson's-related dementia, so a PDD, we can have increased memory issues and judgment. You might hear some kind of muffled speech or some slurred speech, if you will. You also have a very decreased voice, like the patient's almost at a whisper. Definitely hallucinations. We see visual hallucinations are something we see, in nearly all of these patients. They'll have delusions, certainly increased depression, anxiety, and then they also have REM sleep disorder as well. And this is key because as we talked about prevention in one of the other weekly blogs, that sleep is absolutely critical for memory. Absolutely critical for memory, clarity, judgment, mood, all those things. So what happens? These patients don't quite reach that REM sleep disorder sleeping stage, so it does greatly affect their speech. There are multiple treatments we can do for Parkinson's-related dementia, especially working with physical therapy, and occupational therapy. Those folks that can help improve some of the movement issues. And also, as well as the speech pathologies, focus on the swallowing and the voice and the speech. So therapies are very important. From a medical standpoint, when we're looking at the treatment of the cognition, we can certainly use the cholinesterase inhibitors. So that is our Exelon, that's our Namenda, and that's our Aricept. So those are medications that we can use to help improve some of the memory. But also we may see some of those inhibitors also help with some other symptoms such as the visual hallucinations and the sleep disturbance as well that we see in Parkinson's. Now, also, it's very critical because we may see antipsychotic medications being used in patients with Alzheimer's disease or vascular or many other forms of dementia that we see. We must use extreme caution on using antipsychotic medications in patients with Parkinson's disease related dementias, whether it's a PDD or a Lewy body, because we can have some serious side effects. And in fact, up to about 50% of the patients with these type of dementias that are prescribed antipsychotic medications may have increased side effects of more confusion. They can have impaired swallowing, which increases the risk for pneumonia. They can have acute confusion and episodes of delusions and increased hallucinations. And we can almost see a worsening of the Parkinson's symptoms as well as the cognitive symptoms. So this really goes back to it. It is critical for us to understand the type of dementia that we're dealing with. If we have this type of dementia and we treat it with antipsychotic medications, we can see this can have a detrimental impact on the patient and actually accelerate their symptoms. So we're going to be moving into other types. We're going to talk about Lewy body next week, and then we're going to go into talk about frontal temporal lobe, different types of dementias, and we're going to work ourselves into pseudodementia, which also you do see in Parkinson's, which is related to depression. And that's typically treated with our SSRIs or antidepressants. So we're going to go into those as well as many different other forms of dementia. I hope these blogs are helpful so far. We're getting some tremendous feedback, so keep the questions coming. Next week we'll tackle the discussion of Lewy body dementia. I hope everybody out there is staying safe with the coronavirus pandemic. I pray that it all goes away very, very soon and everybody is very healthy. So we'll again see you next week. Thank you.